here has ever had a headache? Quite a few of you. Now, let me ask you another question. Who here has ever felt that that headache was something more than just a typical headache? Not many of you, huh? The patient I have up here is a 50-year-old woman in good general health. She presents with debilitating head pain that began on December 25th, 2013, which escalated to where she couldn't function through the pain. Although she had experienced severe headaches for years, this headache did not disappear. It plagued her daily for weeks. At the urging of her family, she went to a walk-in clinic to have her symptoms examined. When she was examined, the doctor found increased blood pressure, and also she experienced some whooshing sounds when she moved her head quickly, and she also had pressure behind her left eye. He sent her for a CT to be on the safe side, which would happen a couple weeks later. I should mention that this patient is also my mother, and I will never be able to thank the doctor in the walk-in clinic that sent her for that CT. My family and I did not know this until the surgeon operated, but my mother had an abnormality of the vascular system called an arteriovenous malformation, otherwise known as an AVM. Here's the photo. You can see the AVM right there. If you have a brain AVM, you're born with it. You can't catch it. 88% of AVMs are harmless, but 12% can have deadly repercussions. Brain hemorrhaging, debilitating headaches, strokes, seizures are just some of the many things that come along with an inflamed AVM. Today, I will be speaking to you all about the treatment of an AVM, the outlook for a patient with an AVM, and also about the emotional upheaval an unexpected illness can have on a family. During my mother's CT exam, the doctors at Maple Ridge Hospital saw something on her scan that would forever change her life. After her CT scan, my mother was asked to go to the emergency room and wait. Anybody here who's ever had a medical imaging knows that when they ask you to wait around after the scan is done, there's something wrong. The doctor came out and asked her if there was anyone she could call, as they had found a mass in the frontal cortex of her brain, and they didn't know exactly what it was. We were very fortunate in the fact that the doctor had a friend named Dr. Richard Chan, who was a neurosurgeon that worked at a Royal Columbian Hospital. And he called this friend right at that moment, and my mother was admitted into Royal Columbian that evening as Dr. Chan's patient. For 9 days, she was in the hospital undergoing tests to try to figure out whether or not it was actually an AVM, or if it was a brain aneurysm, or if it was a cancerous tumor. AVMs that are inflamed are typically treated with surgery. The ones that are not inflamed are typically just monitored by regular doctor's visits. On the 9th day, they decided to operate. The operation was only supposed to last an hour and a half, but we were sitting outside the waiting room, and 90 minutes went by, 120 minutes went by, 160 minutes went by. Finally, the surgeon emerged from the OR and informed us everything went well, but he still didn't know whether or not it was a cancerous mass or an AVM. They both looked similar on medical imaging, so it was very difficult to decipher what it actually was. Now it was time for us all to play the waiting game and wait for the results of the biopsy. Cancer or no cancer, life or death. That's her after surgery. If caught early enough, an AVM patient has a relatively good outlook for their future if they are in the area of the brain which can be operated on. The problem with AVMs is catching them early enough before they cause permanent damage. Seizures, brain hemorrhaging, and strokes can occur before treatment is done, which can cause permanent brain damage. My mother was very fortunate in the fact that she only presented with headaches, and there was evidence of brain bleeding, but it hadn't escalated to the point of brain damage. There are risks to any surgery, and brain surgery is no small feat. The removal of an AVM is where they take a piece of your skull out, they remove the AVM, they put the skull back on, and then they stitch up your head. If everything with the surgery goes smoothly, the AVM patient has a very good outlook, as there is no more risk of hemorrhaging in the brain. You can see her incision. After surgery, my mother had to go into the neurological ICU. Only 2 visitors were allowed to go in at a time, and my father and I went first. As we went into the unit, the head nurse greeted us at the opening of recovery and asked, "You were told it was cancer, right?" When we shook our heads in shock and she said, "Oh well, you need to keep her calm. Her blood pressure needs to be regulated." How could we help her stay calm when our hearts were beating 1,000 beats per minute? We were told that pathology would take 9 days to come back to find out if there was cancer. This really took a toll on my mother and all of us as a family. It was truly the most agonizing waiting game I've ever had to play. From diagnosis to brain surgery, it was 9 days. There was no time to process, no time to even begin to make sense of what was going on. When we heard the pathology was in, everybody's nerves were completely shot. Life or death, life or death, life or death. That was all I could think about. That day, my family was given the gift of life. Even though we were fortunate there was no cancer, I believe that after the operation, my mother suffered post-traumatic stress disorder. This scare was definitely a traumatic event in her life, and she had absolutely no time to process. People underestimate the mental stress a traumatic event can have on someone. Throughout this health scare, my family and my mother have learned a valuable lesson. Trust your body. Trust your instincts. If you feel like there's something wrong, get it checked out. My mother lived with debilitating headaches off and on for years. These headaches were caused by her AVM bleeding into her brain. My mother got a second chance. She got the chance to see her future grandchildren grow up, see her children graduate university, and even get her own university degree. She will never look at this headache the same way again. She will probably always be weary of anything pain-related with her brain. But she has a chance to do that. I will never be able to thank the medical staff at Maple Ridge Hospital and Royal Columbian Hospital. They saved my mother. Life or death. Life or death. We chose life. Thank you.